Hello. It is such an honor to join you all today for the Pennsylvania Commission for Women and Adagio Health's Breast Cancer Awareness Month virtual reception. Every October, we come together to recognize Breast Cancer Awareness Month, taking a moment to honor the countless individuals who are confronting this devastating health reality that too many of our women are experiencing. This serves as a great reminder that we are still very much together, even when we are physically apart. We are together in our care for the community and in our shared commitment to finding a cure for breast cancer, the second leading cause of cancer deaths in women in our state. This afternoon, you will hear from inspiring leaders like Dr. Johnson, Secretary Beam, Adagio Health, the Pennsylvania Department of Health's Cancer Division, Valley Health Partners, and Metamorphosis Women's Empowerment. They all work tirelessly to raise awareness, connect Pennsylvanians to life-saving early detection services, advocate for patients, and so much more. I hope you know that each one of you here today plays such a vital role in this work. We admire you and are inspired by your dedication to the well-being of your fellow Pennsylvanians. The Wolf administration will continue to do what we can to ensure that everyone has access to affordable, quality health care. That means continuing to support the Pennsylvania Breast and Cervical Cancer Early Detection Program to ensure that everyone has access to free early detection services. And we are so proud to recognize that Adagio runs this program in 62 of the 67 counties of our state. It means working to preserve the Affordable Care Act to guarantee free preventive care and protections for pre-existing conditions like breast cancer. And it means supporting Pennsylvania legislation like Act 52, which Tom introduced last year to address the rising costs and magnified health inequities. We know that these efforts will take the work of all of us, medical professionals, volunteers, researchers, advocates, policymakers, and everyone in between, to continue the fight against breast cancer. And we are up to the challenge. We are honored to work alongside all of you, the healthcare heroes, and to thank you for your continued commitment to the health of Pennsylvania. Thank you.
Thank you so much, First Lady Frances Wolf. And good afternoon, everyone, and welcome to the Breast Cancer Awareness Month reception. I'm Mariah Hathaway, and I serve as the Executive Director of the Pennsylvania Commission for Women. I'm so thankful to be speaking with all of you today and about our health equity heroes and to be partnering with Adagio Health once again. To give you all some background about the Commission for Women, we are comprised of 34 volunteer members from across the state who are responsible for advising the governor on policies and legislation that impact women. We also support economic and civic opportunities for women, encourage mentoring programs for girls and young women, and identify programs for the benefit and advancement of women. But most importantly, we serve as a resource center for Pennsylvania's women. Because we are honoring health equity heroes today, I wanted to let you all know what health equity means to the Commission for Women. To us, it means that everyone has access to affordable and reliable health care. It means advocating for solutions to the issues that impact the health of women and their children throughout their lifetime. Issues like food insecurity, unlivable wages, the lack of quality education, unstable housing, and the maternal mortality crisis. In order to help address these issues, we have been working closely with the Women's Health Caucus, the Pennsylvania Campaigns for Women's Health, the First Lady's Office, the Governor's Advisory Commission on Latino Affairs, the Governor's Advisory Commission on Asian Pacific American Affairs, the Governor's Advisory Commission on African American Affairs, and the Pennsylvania Commission on LGBTQ Affairs. We've also worked with the Department of Health and various other state departments. We have been also forming partnerships with other organizations throughout the state to carry out our mission. We know that health equity has been at the top of everyone's mind, especially in the midst of the COVID-19 pandemic. Last October, the Commission teamed up with the Girl Scouts in the heart of Pennsylvania to make masks for vulnerable populations and communities. During this process, some of the girls earned their sewing badges, and I myself learned a few things about sewing. Overall, we were able to create hundreds of masks to distribute. A portion of the masks were donated to the Pennsylvania Breast Cancer Coalition. The Pennsylvania Breast Cancer Coalition has contributed over $4.3 million to breast cancer researchers right here in Pennsylvania. They've hosted a traveling photo exhibit that emphasizes the importance of early detection and shows the faces of real women across the state with breast cancer. They've also provided resources and information by sending out thousands of free Friends Like Me care packages to newly diagnosed women. The masks that we created were donated and put into these care packages. I have to say, this was one of my favorite initiatives to be a part of because we were able to bring our organizations together to address a need in the community and support breast cancer survivors. We will continue to stand with survivors, advocate for high quality care, highlight prevention methods, and keep fighting until there's a cure. The Commission looks forward to forming more partnerships this year and will continue to advocate for women and girls throughout the state. Again, thank you all so much for joining us today to celebrate Breast Cancer Awareness Month and to help us honor some amazing health equity heroes. And now it's my honor to introduce BJ Leber. BJ has been the president and CEO of Adagio Health since September 2014. She previously served as the president and CEO of Western Pennsylvania Hospital Foundation, as well as interim CEO for the YWCA, the chief of staff for Pittsburgh Mayor Bob O'Connor, and VP and station manager for WQED Pittsburgh's public TV and radio stations. In 2016, she was appointed by Pennsylvania Governor Tom Wolf to serve as the chair of the Intergovernmental Cooperation Authority. She was also appointed by Governor Tom Wolf to the Pennsylvania Commission for Women. She is a member and past president of the Pittsburgh chapter of the International Women's Forum, and she serves on the board of the University of Pittsburgh Institute of Politics, Elsie Hillman Civic Forum Advisory Council, the Pittsburgh Water and Sewer Authority Board, and the Highmark Caring Foundation Board.
Thank you, Mariah. Hi, I'm BJ Leber, and I'm so glad to be with all of you today in this virtual space. We originally hoped for and even started planning to have this be in person, but as we all know, the COVID pandemic is not over, and we really wanted to make sure that everybody was healthy and safe. So we worked with a terrific Mariah Hathaway and the Pennsylvania Commission for Women on a program that would enable us to recognize Breast Cancer Awareness Month, along with the providers and partners who are working so hard to ensure women's health and safety every day. I want to extend our thanks to First Lady Frances Wolf. We greatly appreciate her support for this effort and this event. Before I introduce our next two speakers, I want to share a little background on Adagio Health with you and our work over the past year. Like so many of you, we've seen the pandemic sharpen our focus on health equity. And with that in mind, we rolled out an Adagio Health Better Health Outcomes speaker series, which gave us the opportunity to invite speakers to a virtual space where they provided insight, information, and inspiration around food insecurity, Black maternal health, behavioral health in the pandemic. And next week, we'll wrap up this year's series with a look at what we learned over the past year with regard to race, health, and equity. We certainly hope you'll be able to join us. We are also participating and partnering in efforts to administer the COVID-19 vaccine, particularly in rural areas where we have encountered some measure of vaccine hesitation. The good news is that most of our medical providers live and work in the community where our offices are located. And so they have long-term relationships with our patients and have been able to overcome some of the access and hesitancy issues. And in fact, we just received a grant that will allow us to combine vaccines, including COVID-19, flu, other adult immunizations with our breast screening program. So we're looking forward to rolling that out next year. We're continually looking for new and innovative ways to align our services with the needs of vulnerable populations, and we could not do that without great partners. Pennsylvania's acting physician general, Dr. Denise Johnson, is one of those partners. Prior to serving in her current role, Dr. Johnson was the chief medical officer at Meadville Medical Center. Before that, she spent 13 years in private practice. Dr. Johnson is board certified in obstetrics and gynecology by the American Board of Obstetricians and Gynecologists and is a fellow of the American College of Healthcare Executives. She serves on the Governor's Commission for Women and has been involved in many community and regional groups focused on diversity, inclusion, and the needs of women. Dr. Johnson is the former board chair of the Meadville Area Free Clinic. She is a past chair of the board of directors of the Pennsylvania Coalition Against Rape and a former Adagio Health Board member. She received her medical degree at Georgetown at University School of Medicine and completed her residency at Vanderbilt University Medical Center. It's my honor to introduce Dr. Denise Johnson.
Great, thank you so much, BJ. Are you able to hear me okay?
Yep.
I always have to check with Zoom. So thank you so much for the introduction and having me here. Thank you, First Lady Wolf and Mariah. I'm so glad to be part of this event again. I was really fortunate to participate before, I think when we started this series, and I'm so thrilled to continue. I am disappointed that I have to join virtually, but as BJ said, maybe this is the last year we have to do that. Maybe next year we'll be back in person. So today I want to talk a little bit about the department's health equity efforts as you are celebrating Health Equity Heroes and the relationship between health equity and breast cancer. As you heard before, the Wolf administration places a high priority on health equity. We know that public health crises have the potential to affect all populations, but studies have shown that they typically have more severe impacts on the underserved populations, making those individuals more vulnerable to severe illness and death. Risk factors that we've seen through data from the American Community Surveys include things like poverty and lower education levels, which have been associated with dense living conditions and fewer options for transportation. We've also seen limited English proficiency that has been an issue for some minority groups, and they can have greater risk contracting viruses and more difficulty accessing all types of healthcare services. Black populations and those over 65 may be more directly impacted and have higher risks of contracting viruses and associated deaths. And even separately, we know that outcomes for underserved populations are worse for all types of conditions, and especially for breast cancer. The long-standing systemic and social inequities have put many people at risk of getting sick and dying from viruses, including COVID-19. And that's what we're seeing now, but breast cancer has a similar trajectory. Social determinants of health, as you all know, are factors over which a person has little control, but it can play a critical role in determining their health and health outcomes. Some of those examples are racism, sexism, homophobia, ableism, xenophobia, nationalism, educational disparities, income inequality, housing insecurity, transportation access, health systems and services access, social isolation, food insecurity, unemployment, public safety, and more. It is by assessing this social data that we can see areas of increased disparity and ensure that a higher percentage of people with these vulnerabilities are part of an equitable approach to delivering services. It is a priority of the department to work in this space within our offices, including the Office of Health Equity Services. Additionally, health equity has always been a focus for Pennsylvania Breast and Cervical Cancer Detection Program. Your work is even more important now than it ever was. You focus your efforts aimed at disparate populations in targeted geographic areas by using data. In my formal life, I was supported by Adagio and the Department of Health for more than a dozen years, bringing these services to individuals who might not otherwise have access. From July 1st, 2020 through June 30th, 2021, breast and cervical cancer data show that a total of 6,781 breast and cervical cancer screenings were provided to women through the PA Breast and Cancer Early Detection Program, with state and federal funds. In addition to cancer screening services, 3,051 diagnostic services for breast cancer and 682 diagnostic services for cervical cancer were also performed by the program. Health equity has been taken into consideration in these screening programs. The recruitment of healthcare provider sites and outreach efforts with community partners. The program goals are inclusive and equitable for all participants. As you know, as you've heard, breast cancer is the second leading cause of death in women and is succeeded only by lung cancer. It increases with age, and in Pennsylvania, Caucasian women are slightly more likely to develop breast cancer than African American women, but they are more likely to die of this cancer. Also, African American women over age 50 are at greater risk of cervical cancer than Caucasian women. Cervical cancer is often diagnosed because of missed opportunities for screening, early diagnosis, and treatment. But that's what all of you are focused on. You are reaching out to populations to ensure equitable availability of screening and treatment. And we applaud and honor and celebrate your efforts, and we're so proud to partner with you. Now I'm going to turn it over to Secretary Beam, Acting Secretary of Health, Alison Beam, who's going to further discuss breast cancer in Pennsylvania. Thank you so much.
Thank you, Dr. Johnson. Can you hear me okay?
We can.
That's our first victory. We'll take that. Thank you all for the honor of being able to join you today. As Dr. Johnson mentioned, I'm Alison Beam, Acting Secretary of Health here. Thank you to First Lady Wolf and Mariah and BJ and Dr. Johnson for letting me join you all here today. And admittedly, we may be joining remotely, but it is a powerful feeling to be surrounded by countless partners advocating for breast cancer awareness. Unfortunately, we know, as has been stated, that breast cancer is the second leading cause of death among females, and that the risk can increase with age. And in fact, every day in Pennsylvania, 37 women are diagnosed with breast cancer. But events like these draw our attention towards breast cancer awareness. And this event also honors those who have fought breast cancer and those who have tragically lost their lives to it as well. These events remind us all that you are not alone and that there is support and are programs available to ensure you have access to screenings. Seeing Pink makes us know that early detection can be a key to fighting breast cancer. We know that screening for breast cancer is critical to the survival and positive outcomes for clients who develop breast cancer. Early detection can identify breast cancer before it gets to the later stages, where treatment is much less effective. At the Pennsylvania Department of Health, we have a program for low to moderate income working families with no insurance or those that are underinsured to provide breast cancer screening. The PA Breast and Cervical Cancer Early Detection Program allows for breast cancer screening for patients ages 40 to 64 and cervical cancer screening for those ages 21 to 64. Younger clients with symptoms are eligible, as well as clients if they are under 40 years without symptoms, but are at high risk for breast cancer. 3D and digital mammograms, ultrasounds, and MRIs are all available free of charge through this program for breast cancer screening. This program also includes cervical services like Pap tests, HPV tests, and several diagnostic procedures. Within just the past fiscal year, this program was able to detect cervical and breast cancer for 113 individuals among the nearly 7,000 who utilized the program. That's 113 women who were able to get a jump on their cancer and improve their odds. Together, we continue our mission of making a healthy Pennsylvania for all. And we encourage everyone to take steps to control your health and help reduce your cancer risk today by staying away from tobacco, getting to and staying at a healthy weight, moving with regular physical activity, eating healthy with plenty of fruits and vegetables, limiting how much alcohol you drink, protecting your skin with sunscreen, and knowing your family's health history and your risks. And finally, getting those regular checkups and cancer screening tests. It is such an honor to be able to join you all today, and I thank you for the opportunity to speak. Thank you.
Thank you so much for being here, Allison, and thank you for your work and pursuit of better health for Pennsylvanians. Also joining us today, Adagio Health Senior Director of Health Promotion and Disease Prevention, Casey Monroe. In her work, Casey oversees the administration of Pennsylvania's breast and cervical cancer early detection program in 62 counties across Western, Central, and Northeast Pennsylvania. Casey also oversees the Adagio Health Mammogram Voucher program. Before joining Adagio Health, Casey served as the Director of Performance Management, Quality Improvement, Accreditation, and Special Projects at the Allegheny County Health Department. She also served as the Executive Director of the Methodist Union of Social Agencies, working with early childhood and school-aged youth programming. She is a person I am glad to know and to work with every day. Here is Casey Monroe.
Thank you so much, BJ. Hi, everyone. As BJ introduced, I'm Casey Monroe, Senior Director of Health Promotion and Disease Prevention at Adagio Health. First, I want to extend my thanks and gratitude to the Pennsylvania Commission for Women, who organizes a terrific event every year and is keeping it going despite the global pandemic we are all continuing to navigate. I also want to welcome everyone, including some of our past honorees who are joining us today. Part of my role at Adagio Health is overseeing the Pennsylvania Breast and Cervical Cancer Early Detection Program, better known as BCEP, in 62 counties of Western, Central, and Northeast Pennsylvania. The Breast and Cervical Cancer Early Detection Program is available to underinsured and uninsured women ages 21 and over. Eligibility is based on income and household size. And through this program, eligible women can receive free breast and cervical screening and diagnostic testing. Adagio Health is also proud to offer free breast cancer screenings to eligible men and women through our Mammogram Voucher program. The Mammogram Voucher program has no gender or age restrictions. Adagio Health is also proud to partner with the Department of Human Services and the Department of Health to manage the Breast and Cervical Cancer Prevention and Treatment Program. This program is for patients who are diagnosed with breast or cervical cancer or any other precancerous conditions who lack credible insurance. Through this program, patients who qualify will be able to access the care and cancer treatment they need at no cost. Through these free programs, Adagio Health helps over 12,000 patients annually with free breast and cervical cancer screening and treatment services. I want to take a moment and thank the Adagio Health Cancer Screening Team, for without their commitment and passion, none of this would be possible. I am so proud to support a team of patient navigators, administrators, and managers that make this work possible and who are on the call today. Thank you all for what you do. According to the CDC, health equity is achieved when every person has the opportunity to attain his or her full health potential. And no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Programs like BCEP and the Mammogram Voucher Program help us to move closer to health equity. The tireless work of our partners and providers to increase access and decrease obstacles for patients when it comes to obtaining care help us move just a little bit closer to health equity. With our partners, Adagio Health has been working to reduce health disparities for 50 years. Today, we are proud to honor some of the partners, colleagues, and friends who share that goal and who work every day to help patients receive the screenings and care they need in the fight against breast cancer. They are heroes on the ground advocating for policy change with our partners, screening patients in our health systems, and liaising with local, state, regional, and national partners for sustainable funding to cover these life-saving services. One thing our honorees have in common is their tireless advocacy for those who are uninsured and underinsured. Access to reliable and high-quality healthcare is a top priority to them all, as they demonstrate an unwavering commitment to ensuring equitable healthcare for all. Our first honoree that I am proud to introduce today are our friends at the Department of Health. We welcome the Department of Health Division of Cancer Prevention and Control within the Bureau of Health Promotion and Risk Reduction. The Division of Cancer Prevention and Control is charged to provide statewide leadership and coordination of cancer prevention, early detection, treatment, and quality of life services and resources. In partnership with the cancer and chronic disease community, the division promotes cancer education, awareness, and services through policy, systems, and environmental changes to provide a better quality of life by reducing the effects of cancer. Most notably and related to today's program, the division provides low-cost breast and cervical cancer screening and diagnostic services to low-income, uninsured, and underinsured women through the Pennsylvania Breast and Cervical Cancer Early Detection Program. Today, we will hear from Rebecca Kishbaugh, the division director, and Diane Donahue, the provision manager from the Breast and Cervical Cancer Early Detection Program. On a personal note, our colleagues at the Department of Health work tirelessly to ensure women in Pennsylvania have access to high-quality healthcare through breast and cervical cancer screening services across the Commonwealth. We are so grateful to call them our partners and friends.
Thank you, Casey. Good afternoon. I want to thank everyone for this recognition. We greatly appreciate it. But honestly, it would not be possible without the wonderful collaborations we have with all of our partners. I am Becky Kishbaugh. I oversee the Division of Cancer Prevention and Control at the Pennsylvania Department of Health. It has been our honor to be able to administer this program since 1994. I am now going to introduce you to Diane Donahue. She's the statewide cancer screening manager and has been doing this for over 7 years. Diane will share some of the program's work around health equity. Diane?
Thank you, Becky. And thank you to the Pennsylvania Commission for Women and Adagio Health. We received that award and I was so impressed. It's very beautiful. And I told some of my colleagues that we're just going to have to build a new shelf in the office to display that. So for breast and cervical cancer early detection program, health equity means that all people get the right screening at the right time for the best outcome. This is the strategic priority of CDC's Division of Cancer Prevention and Control, and for us. Because African-American women are diagnosed with breast cancer at a later stage and are more likely to die from breast cancer than white women, focusing on increasing screening rates for African-American women is a priority. We set ambitious goals, we track these screening numbers, and make sure that there are healthcare providers in African-American neighborhoods. We also worked for 2 years with the Association of State and Territorial Health Organizations, ASTO, and the National Association of Chronic Disease Directors, NACDD, to understand where Black women live and the corresponding health disparities. Based on this data, Dauphin County was chosen as the first area to implement an evidence-based intervention with the YMCA. Over the past year, staff education about health equity and its connection to health outcomes has begun and will continue. The NACDD's President's Challenge focused on advancing the strategic priority of racial equity and chronic disease programs. All of our Bureau members were asked to complete the American Public Health Association 6-part webinar series. And I have to tell you from a personal point of view that the most impactful of those was the one by Richard Rothstein, who wrote The Color of Law, A Forgotten History of How Our Government Segregated America. It was really eye-opening to me to learn about how segregation was built into laws, policies, and even private sector contracts. So I'm going to try to put this link to the webinar in the chat, and I would encourage you to take a look. BCC EDP partners with the YMCA and Penny, the state health insurance exchange, to conduct a health equity tour, which began in May. The Health Equity Tour is a series of in-person events throughout all 67 counties in Pennsylvania, and it focuses on access to health resources. This is an especially effective health equity effort because it meets people where they are. Women are referred to BCC EDP for breast and cervical cancer screening. Education is also provided on a wide array of evidence-based chronic disease programs, such as COVID, vaccines, diabetes, tobacco cessation, and many others. To date, the tour has been to 37 counties and was attended by over 3,500 people. Language is another health equity barrier. Health Promotion Council gives patient navigation services to help women overcome barriers to obtain screenings. Spanish-speaking staff are on hand there at Puentes de Salud, La Comunidad Hispana, and many other providers. Interpretation services are available in many other languages too. Telehealth provides a way to overcome the barriers of transportation, childcare, structural barriers like out-of-pocket expenses. The Fox Chase Mobile Mammogram Unit provides services in Philadelphia in areas of need. It goes to churches, community events, and work sites to allow employees to get their mammograms without having to use sick time. There were obstacles to achieving health equity in the last year. Many were due to COVID, and we did overcome them using the activities previously mentioned and many others. We are committed to health equity, but there's much more to be done. CDC recognizes this and is increasing the emphasis on health equity strategies, as are we. Each program goal and activity will now have inclusive and equitable attributes. This helps everyone to focus on these outcomes. So thank you for your time. And again, thank you for this award.
Thank you so much, Diane and Becky. Next, I'm pleased to introduce the Metamorphosis Women's Empowerment Initiative, which is a multifaceted community-based organization which strives to serve as a catalyst for positive change, to empower and advance women of all ages in all aspects of their lives. Through strategic alliances with community organizations, programs to address food insecurity challenges, creation of educational and empowerment programs, mental health and support groups. We came to know our friends at Metamorphosis through a women's health fair held in East Stroudsburg, Pennsylvania in May of 2021. Adagio Health and Lehigh Valley Health Network offered free mammograms and cervical screenings to the community at the health fair. Today, we will hear from Cherise Sanders, president and founder of the Metamorphosis Women's Empowerment Initiative. Cherise was born and raised in Harlem, New York. Growing up in the inner city inspired her to become a voice for the youth in the African-American community, serving as a writer, newspaper editor, youth activist, and advocate for teens who were survivors of suicide attempts, rape, and sexual assault. Her passion for community service and outreach prompted her to serve in the medical profession for 16 years in the nursing field. We will also hear from her partner, Pastor Araceli Mitchell, senior pastor and founder of Passion for Christ Church of East Stroudsburg, Pennsylvania. Pastor Mitchell has a long-standing commitment to equity, which includes running a food pantry within the church. Her mantra for the pantry is that hunger and poverty is unacceptable, and it is her hope to reach those who are in need by providing food, clothing, and essentials through the local church pantry. She has also established the Passion Project, which goes beyond providing food to low-income and underprivileged families to connecting them with resources to help meet their needs, like obtaining adequate housing, medical assistance, household donations, and other services. Now we're gonna look at some great photos they sent us before we meet them.
Good afternoon, everyone. Thank you so much for having us here. I am deeply honored. I am Sharice Sanders, and this is Pastor Araceli Mitchell. We can't begin to tell you how much of an honor this is. We want to thank everyone, the Commission of Women and Adagio Health, particularly Casey and Tracy. You guys have been awesome. I don't know words, but is the best I can get, and I appreciate the fact that you all supported us in our inaugural endeavor to reach out to the women in our community. I wanted to give you a little background on the Metamorphosis Women's Empowerment Initiative. We create programs and tailor services to empower women to be the best selves at every phase of their lives. We take a holistic approach to helping them with the goal of not putting a temporary Band-Aid on their situation, but address the source of it and create a suture for long-term healing. We focus on 4 primary foundation stones. First being food security. If a woman and her family eats well, this promotes disease prevention and general wellness. Second, we promote mental health because how someone views themselves and their circumstances will drive their actions, affecting their outcomes. Third, job readiness to prepare them to be marketable to obtain employment in a competitive job market, making higher wages, creating financial and home stability. And fourth, healthy lifestyles, which addresses health issues which affect women such as obesity, diabetes, high blood pressure, breast and cervical health, and more. MWEI seeks to partner with organizations with the same mission. Meeting Pastor Araceli Mitchell, who has supported MWEI from day one, was a blessing. We are truly kindred spirits from the start. Collaboration on the Passion Project appropriately fit into both missions. And through the collaboration, we were able to offer numerous families and women from impoverished and asset limited, income constrained, employed communities, ALICE communities, the opportunity to begin to obtain health equity and general healthiness. Our 2021 Passion Project Women's Health Fair was just the beginning of our work in our communities to help women and their families to live better lifestyles.
Good afternoon, everyone. I just want to say a few words and piggyback off of Sharice. As our relationship has grown strongly because of the passion we have for our community, I want to thank Governor Wolf and First Lady Wolf for from the top down, and BJ and PA Commission for Women, and especially Tracy and Casey. Casey, I thank you so much for answering the call. Absolutely. And we have made an impact in our community. And from the very beginning, we have decided in this area that we would like to address the hunger and the poverty situation for the underprivileged and those who are in need or low income, and whatever we can do. I, as a pastor and a senior pastor of Passion for Christ Church, I've stepped out of the 4 walls and determined and decided that we were going to do more, not just those that walk in the door, but those that are outside. And we have come together to do that just in our community and allow our efforts and our ministry to service those who are in need. And we run a large pantry. We are dedicated and devoted to giving out, doing and getting together for children, men, women, families, and just the community as a whole. So I want to thank you for recognizing us this year, and I thank you for the opportunity to become a member of those who are doing wonderful things for the community, wonderful things for the women. Especially our passion is towards women as well, and there's so much that are in need. We cannot necessarily fight this poverty and hunger and situation ourselves, but I thank you for allowing us to become partners in whatever part we can play. So I just want to thank you again for this unexpected honor, and again, for our relationship that we have, that whatever we can do to help, let us know, and we're there. Thank you.
Thank you.
You are so welcome. And as always, it's wonderful to work together. Last but certainly not least, we will hear from our partners at Valley Health. Valley Health Partners Center for Women's Medicine provides comprehensive healthcare for women in Allentown, Pennsylvania. As a federally qualified health center lookalike, they do not turn patients away because of their inability to pay. They provide gynecologic care, cancer screening, prenatal care, and screenings for sexually transmitted diseases and HIV. Valley Health Partners also provides free prenatal classes in English and in Spanish. In addition, Valley Health Partners provides interpretation, transportation, and health education in the community they serve. As part of the Breast and Cervical Cancer Early Detection Program Network, Valley Health Partners Center for Women's Medicine works tirelessly to serve patients and support them through the continuum of care. Today, we will hear from Kathy Ayers. She has been a nurse for 35 years, primarily working in women's health. She spent most of her career working for Lehigh Valley Health Network and now works for Valley Health Partners Community Health Center. Kathy spearheads the Breast and Cervical Cancer Early Detection Program at Valley Health Partners Center for Women's Medicine in Allentown, Pennsylvania. Kathy's role involves providing OB/GYN care, following up with patients after abnormal screening, and educating colleagues about the BSEP program. Now we're going to look at some great photos they sent us before we get to meet them today.
Hi, everyone. It's good to see you all. It's good to learn more history about the program from everybody who spoke before me. My name's Kathy Ayers. I am an LPN. I have actually been doing the Healthy Women program now, Adagio, since 1994, maybe a year after you started. I got to this office because my uncle was the first practice that the hospital bought. And I worked with him 10 years prior, learned wonderful things about women's medicine. Such a good teacher he was. I never thought I'd work at an office, but when I came over here, I really took to heart the things that he taught me with the way he was as a person and a human being and a doctor. And, fortunately, his knowledge passed on to me helped me to do this program. I'm very grateful for the award. I can't think of a year when I've been more busy, even with COVID. But I think some people coming back after being, a little timid to come during COVID, our numbers really soared. Let me just go to the paper that I have here. I love working with women. I love the fact that because of your program, we can help more women than we've been able to in the past. I wish I had kept a tally of how many women we have screened who've had breast cancer or cervical cancer. On a personal note, I'm a breast cancer survivor myself. A year after my diagnosis, the women in my family I encouraged to get mammos, and my sister was uninsured. And I brought her through Adagio, and she also was diagnosed with breast cancer, but also a survivor too. So you can't, I wish you could see it here. I just wish you could see how the women, they're so grateful for this care. And I'm proud of my office. I'm proud of my coworkers for the help that they give me to do this. Thank you, Adagio, for your support. And I know that Tracy probably wished I was 30 years younger, so I didn't have so many computer questions. But anyway, I'm glad you're here. And thank you for everything that you do and the opportunities that you give us to help so many women. Thanks.
Hi, my name is Dawn Kehoe. I am the clinical manager of this amazing team, Valley Health Partners Community Health Center, also known as VHP. Center for Women's Medicine is actually under the umbrella of VHP and did definitely recently receive the VQHC or FQHC LA Federally Qualified Healthcare Lookalike, which is a designation by the U.S. Health Resources and Services Administration, or also known as HRSA. The goal of this practice is amazing. I mean, we provide compassionate care, family-centered, that's culturally sensitive for any, regardless of the ability to pay. It's definitely the basis of what we do and the basis of our organization's mission. And this is just an amazing opportunity to be able to share this with Kathy. She is one that has really taken a hold of this and really has made this her own. So thank you for the opportunity to be able to speak on behalf of VHP.
Well, thank you so much. And thank you so much, Kathy, for sharing your story with us. And I wanted to just say thank you to everyone who joined us today for this amazing and empowering program that we were able to put on. I too wish we were able to see each other in person, but I'm looking forward to partnering with Adagio Health again next year and hosting something maybe in Harrisburg, maybe even at the governor's residence. So wouldn't that be a treat? I just wanted to congratulate the Department of Health Cancer Division, the Valley Health Partners, and the Metamorphosis Women's Empowerment Initiative again for being honored as our health equity heroes. You are welcome to partner with the PA Commission for Women. If you would like to reach out to us, I'd be happy to chat and see what good things we could do together as well. And I also just wanted to thank Adagio Health and the First Lady, Secretary Beam, and Dr. Johnson for helping make this event possible. And I do look forward to continuing working with all of you to fight against breast cancer and advocate for a cure. And for those of you who haven't yet, don't forget to schedule your mammogram and remind others to do the same. And I hope you all have a wonderful weekend. And I'm going to toss it back to BJ Leber from Adagio Health once again. Thank you.
Thanks, Mariah. I just get the opportunity to give one more round of thank yous, one more round of shout outs, and say goodbye to everybody. So I do want to thank First Lady Frances Wolf, Acting Physician General Dr. Denise Johnson, Acting Secretary of Health Allison Beam, all of our partners and fellow care providers, including the health equity heroes that we were so proud to recognize today. The great folks at the Pennsylvania Department of Health Division of Cancer Prevention and Control, Valley Health Partners Center for Women's Medicine, and the Metamorphosis Women's Empowerment Initiative. Well done, everybody. Thank you so much for joining us today. We hope to see all of you in person next year. In the meantime, be well. Goodbye.